Ahi wa barakatuh. Welcome to another edition of Hilaal Live. I'm your host, Luqman Shadrach. Thanks for watching us on Channel 347. Remember, you can also download our apps on Android and iPhone as well. Tonight, we catch up with an NPO or NGO that's doing amazing work and that has been assisting our community for many, many years now. And that organization tonight is called Choc, Childhood Cancer Foundation. And joining us via Zoom is the regional manager of the Western Cape, Lynette Mutarey. Good evening, Lynette, and welcome.
Good evening, Shadrach, and good evening to your listeners.
Absolute pleasure having you on. Luqman's the first name. Shadrach's the second name. Just to let our viewers know a little more about some of the wonderful work that you guys been doing. But let's take a step back. How long have you been in existence for? Give us a bit of history.
Oh yeah, Choc was founded in 1979 by a group of parents in Johannesburg whose children were diagnosed with cancer. There was particularly one couple whose daughter was diagnosed with cancer in 1979. Sure. And at that time, she was treated at Joburg General Hospital. And they saw a great need for other parents to receive support, practical support, emotional support. And they started by supporting each other through just getting together, sharing their experiences and their challenges, forming support groups. And since 1979, we've become the leading childhood cancer organization in South Africa. So this year we are commemorating our 45th birthday.
Congratulations. That's a lot of years in existence and a lot of years under your belt where you've gained quite a bit of experience. During these 45 years, and I can imagine, you know, cancer, especially when a child gets cancer, must be so heartsore for the parent, for the family, and the ripple effect that this has on the family. Do you do any special programs to assist both the family and the child affected with cancer?
Yes, we do. Choc operates in 6 regions around the country. We refer to our regional offices as regions. And in all these regions, we operate very closely to the pediatric oncology wards, the hematology wards, and the oncology wards. We mostly work with the pediatric oncology wards and the hematology. And one of the services, we provide a range of comprehensive services that supports both the patient and the parent. Mm-hmm. One of our services, to just start and mention a few, is our home away from home accommodation. We have 13 facilities or Choc houses where children live once they are diagnosed with cancer or a life-threatening blood disorder, and they reside 50 kilometers away from the treatment center. Mm-hmm. So as you know, when a child undergoes cancer treatment or even an adult, the period of treatment can be quite long and quite extensive. And accommodation close to the academic hospitals can be very costly and financially burdensome on the families. So we have our free home away from home accommodation, our Choc houses, and they all work very closely with the academic hospitals where you find a pediatric oncology ward, and the pediatric oncology wards then places the patients that are long distance at the Choc houses as well as the parent, and they stay at no cost for the full duration of the treatment. And then other than the Choc houses or our accommodation, we also have a national psychosocial support services program where we employ social workers that are placed in the pediatric oncology wards around the country. Up to today, we have 19 social workers that assist in the wards with counseling, debriefing, treatment preparation. Even once the family have unfortunately lost the child due to cancer, they provide bereavement support. We also do a lot of practical support. As you know, many times one parent or at times the mother has to resign from full-time employment to be next to the child for the duration of the treatment. And that means that many households then have one income less. And many families in South Africa already are faced by so many economic challenges. Socioeconomic challenges. So some of our practical support services we provide are things such as nutritional support, where we help families with things such as food hampers, food vouchers through our social work program. We also assist families through a transport fund if they need to access treatment through using public transportation like taxis, buses, or trains. We also provide care bags to newly diagnosed children. And then we also have hospital volunteers and ward volunteers who are trained volunteers that have been with Choc many, many years. And they also volunteer in the pediatric oncology wards, and they provide non-professional emotional support to many of the families.
Brilliant.
Some of these hospital volunteers helps with tea mornings, where they provide a light snack, tea, coffee to the moms while they are waiting in the outpatient clinics for treatment. We also do a lot of awareness raising because in South Africa, the survival rate amongst children with cancer is only 55%, while nationally, in first world countries, the survival rate is between 70 to 80%. So in South Africa, we do a lot of awareness raising whereby we train medical professionals such as nurses, registered nurses, trainee student nurses, traditional healers, ECD teachers on the early warning signs of childhood cancer.
Wow, that's quite a bit that you guys do. Sorry, to interject, you had one more that you'd like to add.
No, I wanted to say we also work with childhood cancer survivors around the country. Yes.
Brilliant. Yeah. Brilliant. Well done. Kudos to you and your team for all that you do, especially the volunteers as well. But give us an extent with regards to how prevalent or what type of cancer seems to be more prevalent amongst our kiddos.
Yeah, in South Africa, the most prevalent childhood cancer still remains leukemia. And the prevalence of childhood cancer, or the statistics that we've seen and received, shows that we have about 1,000 newly diagnosed children in South Africa per year. And we can even break it down further, where we've seen that about approximately 1 in every 408 children are diagnosed with cancer. So there are approximately 1,000 newly diagnosed kids nationally in South Africa, with leukemia being our most prevalent childhood cancer.
Right. What are some of the awareness campaigns that you undertake? Do you have any monthly, yearly campaigns that you do?
Yes, we do awareness on an ongoing basis. So one of the things, as I shared earlier, each Choc region has what we call retired nurses and community trainers that work tirelessly in various communities, targeting various target groups. One of the target groups they do target are our nurses, and the members of the public can contact us if they are at a facility where there are nurses, and we gladly will visit that facility at a scheduled date where our nurses or retired nurses visits that facility and educates them on the early warning signs of childhood cancer. We also do work with traditional healers, traditional leaders under the auspices of the Department of Health, where we also train them on the early warning signs of childhood cancer. And normally during the month of September, which is International Childhood Cancer Awareness Month, or the month of gold, which is the childhood cancer color, we do raise a lot of awareness on childhood cancer. But we do encourage the public to contact the nearest Choc office, and even if they work in a childcare facility or as an ECD or high school, primary school teacher, they can contact us to schedule workshops or talks on the early warning signs of childhood cancer.
Brilliant. Thank you for sharing that. Lynette, are there any campaigns coming up? What's in line for the Choc Foundation in the next couple of months?
Yes. September, we're commemorating International Childhood Cancer Awareness Month. And not only in South Africa, but internationally, we're asking people to please contact the nearest Choc office and obtain a gold ribbon from the nearest Choc office and wear that proudly to show their support for childhood cancer, and just showing support for those little warriors that are on the journey of battling childhood cancer. We're also doing a media campaign where we will be notifying the public of what are those signs to look out for. Schools can contact us for early warning sign leaflets and posters in various languages, but most corporates or members of the public can contact the nearest Choc office and ask us to help them in obtaining a Choc gold ribbon, and we're encouraging people to wear it during the month of September, and in doing so to raise awareness on childhood cancer. And if members of the public want to support Choc in a practical way by either making a donation or a donation in kind during the month of September, they can also gladly contact Choc.
Thanks, Lynette. I'm sure we'll share some of your details as well. Speaking about details, how do people get hold of you? What are the best methods? Maybe some of your social media handles or sites that our audience can visit.
Yes, yes. So people can contact us at the nearest Choc office. Our Choc offices are all listed on our website. Here in Cape Town, we are located in Sabron Park, and they will find our details on our website, which is www.choc.org.za.
Regional Manager for Choc Childhood Cancer Foundation South Africa, Lynette Muthere. It's been an absolute pleasure. Thank you for affording me your time. All the very best. Have a good evening.
Thank you so much, and thank you to your listeners.
You're welcome. And that's Choc. Do go and visit them if you feel the need to get hold of them for assistance or just to donate where you can. Do go and check them out on all the good social media platforms. We're going to take a short break. When we come back, we do another NPO Focus. Thanks for watching us on Hilaal Live.